Hi, this is Dr. Derek Mahoney, Specialist Orthodontist. Excited to introduce to you a program where 4 specialists, including myself, will be discussing clear aligner therapy. Now, this is not a course for beginners. We're assuming anyone coming to this course is already using clear aligners. What is this course for? It's for people to understand what clear aligners can and can't achieve. I understand there's so much more litigation in Australia because general dentists are starting aligners and they're promising the patient the world and it doesn't really happen. Why is this so? Because people just assume whatever movement is occurring on the computer will actually occur in the mouth. There's certain parameters that clear aligners are not good for, vertical movements, etc., etc. So in this course, the 4 specialists will tell you what a safe case is for aligners and what a case is you really should be considering fixed appliances. For instance, if a case needs more than 35 of aligners and you're a beginner in the field, should you really be tackling that case or not, right? Second thing I'm going to go through is the biomechanics of tooth movement. We're going to cover amongst the 4 of us these categories. Deep bites, open bites, class 2 jaw, class 3 jaw, cross bite, bidental protrusion cases that do need retraction. We'll talk about either distal driving or sometimes extracting premolar teeth to make the room. And every time the mechanics are different. What do I mean by the mechanics are different? When do you need tabs with your aligners? When do you need elastics with your aligners? What attachments do you use for all different movements? So if you're currently doing aligners and you're not being able to get the case done without 2 or 3 refinements, it means you don't really know what you're doing, to be honest, right? So why don't you come to this course? I'm donating my time free of charge. I'm donating my lecture center free of charge. Why? I'm helping the students of Sydney University. I'm very lucky. I went through my dental education under the Whitlam years. I did not pay 1 cent for my dental education. I understand now these poor guys have to pay $50,000 to $80,000 a year, and that's a lot of coin. So what we're doing is we're generating a really cheap fee, $2,000 for 2 days of solid education, no BS, all practical, with 4 specialists who do a lot of aligner therapy, right? So for that price, that $2,000, every cent of it goes through to the Sydney University Dental Student Scholarship. They're not going to use it for beer drinking. They're going to use it to help students who are maybe struggling to pay their fees, etc., etc. It's a really worthwhile cause. I call this paying it forward. I've done really well in life thanks to being a specialist. I'd like all these young people to do well in life as well. So I have my colleague who works at Full Face Orthodontics, Sarah Yusufina, very, very experienced in clear aligner therapy. We have Dr. Zhu, who's done a lot of research in this field, a lot of publications. Dr. Vass from the sunny coast, he actually did all the clinical trials in the world for Spark aligners and has a beautiful practice focused on aligner therapy. And we'll be talking about mixed dentition, permanent dentition, missing teeth. It's really everything you want to know about aligners in 2 days' time. So please register early. There's limited seats. It's 16 hours CPD. There's going to be a cocktail party on the Saturday night. I look forward to seeing you there. Thanks.